I'll just introduce myself. So my name is Osha Towers. My pronouns are they, them. I'm Black, I'm queer, I'm non-binary, and I work at Compassion and Choices as the LGBTQ outreach manager. So I have been more recently able to come into this work. But before this, I was also working with the LGBTQ community in a variety of different activities, whether working with young people or legislation or just hosting community events. And through the time of COVID, in the early stages is when I really started to get into learning about death doulas and end-of-life planning. So when I was able to find this job, it was like a perfect connection of those two passions. And this event really came together because one of the first things I did when I got this job was I was able to attend a Reimagine presentation that was a table talk called the LGBTQ Values, Wishes, and Plans at End of Life presentation. And it was done by Jacqueline Boyd and Maren Lucas. And they did a phenomenal job. And one of the questions that just kept coming up was about healthcare proxies. So I'm like, yes, that's so crucial and important for our LGBTQ community. So I brought that back to our staff, and people were so excited because that was already something people were thinking about and trying to make a presentation on. So it just worked smoothly, and Reimagine has been such an amazing partner. So we're excited to be able to get this going for everybody. And to give you an idea, if you're not familiar with Compassion and Choices, we are a 501c3 national nonprofit organization working across the country to focus on improving care, expanding options, and empowering everyone to chart their end-of-life journey. And so our goals today is really just about hearing about LGBTQ history and what it looks like to plan our own end-of-life care. So without going into more information, I'll just start off with letting Alina introduce herself.
Thank you for that. And I just want to acknowledge that Doug was not getting any audio, so he left, and he's going to be coming back in.
Okay, for sure.
Okay. So hi, everyone, and I'm really both excited and grateful to be here. Let me introduce myself a bit. I've been a political activist most of my adult life. I come out of the labor movement, where I learned skills that I've used all throughout my life, including the end-of-life work that I currently do. I've also worked on issues in the LGBTQ plus community, HIV and AIDS community, fought for women's rights, and and I'm an end-of-life activist now. So I feel like once an activist, always an activist, right up to the end. I'm bringing it in. I'm a fierce advocate for patient-directed care in medical aid in dying. For folks who aren't familiar with medical aid in dying, let me interrupt for a minute. Doug, do you have audio now? Doug, raise your hand if you have audio now. It doesn't seem like it. Okay. I'm sorry for interrupting. So I'm a fierce advocate for patient-directed care. And for folks who don't know what medical dying is, I will explain. It's a medical practice that allows mentally competent, terminally ill adults to request a prescription for medication from their physician, which the person may ingest to die peacefully in their sleep, if and when they choose. Death with dignity is the name of the law in both Oregon and Washington that makes medical aid in dying legal in that state. End of Life Option Act is the name of the law in California that makes medical aid in dying legal in California. So when you hear me use these three terms today, you're going to know that they're interchangeable and they all really refer to the same thing. I've been involved with the Death with Dignity movement more than 40 years. I help facilitate death cafes for Hospice of Santa Cruz County. And I often get asked, well, what's a death cafe? So they were started in England by a man named John Underwood in 2011. He felt that folks were reluctant to talk about death in their culture, just like in our culture. So he gathered a small group of people in his living room who were interested in talking about it. A death cafe is a scheduled get-together for the purpose of talks about death over food and drink, and it's usually tea and cake. There's no agenda, there's no leader, folks attending only answer one question. What brought you here today? And from there, the conversation begins. Death cafes are now happening globally in 66 countries. And I also volunteer with Compassionate Choices, obviously.
Thank you for all the amazing work that you've been able to do over the years. I'm curious, how did you first come to Compassionate Choices?
Well, actually, and I don't think many people know this, but I came to Compassionate Choices as a patient. I was diagnosed with stage 4 lymphoma, and 2 weeks later, I got a brain tumor diagnosis. You know, just to keep things interesting. I actually refused chemo and I refused brain surgery. My oncologist told me if I didn't do exactly what he said, that I would die. And he explained to me how I would die. That my lymph nodes would be enlarged more, they would impinge on my organs would shut down, and I would die. In silly me, I believed him. I chose death over chemo. I'm known to be a badass, but that was definitely the bravest moment of my life. I treated both the cancer and the brain tumor with homeopathic remedies. That was 12 years ago. Clearly, I didn't die. I continued to survive and thrive. The cancer, the brain tumor, and I all cohabitate in my body right now. We're all getting along really well. You can imagine the huge appreciation I have to be alive every day after having my life threatened like that. It's not always easy to share my story, but I do it to inspire others. And I hope that it will inspire you to be involved in your own medical decisions. So then I started to get involved with Compassionate Choices as a volunteer instead of as a patient. And basically, I came to Compassionate Choices and I just never left. And that happened just when they were bringing the End of Life Option Act to California legislature. And because I had a background in the labor movement, I had experience in getting laws passed. So I'm one of many volunteers that made the trek to Sacramento numerous times in an effort to get that law passed. I currently run the Santa Cruz Action Team for Compassionate Choices. I serve on their National LGBTQ+ Leadership Council, and I do presentations for them on advanced directives, dementia, and medical aid in dying. I am also a storyteller for Compassionate Choices. My story is on their website. Let me encourage you to check out the website, compassionandchoices.org. There are many folks sharing their stories. My story is really about patient-centered care, but others talk about various end-of-life issues. So again, let me encourage you to visit our website and check out different storytellers because the stories can be very inspiring.
And your story is inspiring and also a known badass. That is so accurate to exactly what I think of when I think of you. So that is wonderful.
Thank you so much, Alicia.
Of course. And I didn't say this earlier, but I just want to say what an honor it is to be able to do this presentation with you and just to get to know you.
Thank you so much.
Of course. And I was also curious, so you've mentioned medical aid in dying a lot now, and I'm wondering how you first became aware of MAID.
So medical aid in dying first came on my radar in the early 80s when HIV and AIDS hit our community. And those of you who were there know that there was incredible suffering, indescribable suffering, like we've never seen before or since. And people were asking for help to die. We used to say it was like a nightmare we couldn't wake up from. But back then there was no way to legally end your life or help anyone in their life, regardless of the prognosis. And behind me, you see a picture of the AIDS quilt when it was brought to Washington, D.C. At that time, it was the entire quilt. Of course, years later, the number of deaths from HIV and AIDS has continued to grow. I think the photo is a good visual reminder of how so many people suffered and died. from AIDS, as well as the huge impact it's had on our community. It took President Reagan 7 years to just say the word AIDS. We called it the official silence back then. People were fearful of anyone living with AIDS. There was some that wanted to send everyone with AIDS to an island, saying AIDS was God's punishment for being gay. They were afraid to touch us. They were afraid to be around us. Just to visit someone with AIDS in the hospital, we had to cover up from head to toe, from hats and masks, all the way down to shoes and booties. Of course, we'd pull it all off as soon as we got in the room. And, you know, in spite of all the fear mongering, we'd just climb right into bed with our friends and loved ones. But nobody would help us. No one would recognize the epidemic as a public health emergency. Not the president, not the CDC, and not the FDA. And so we gathered. We gathered together to take care of ourselves and each other. We formed ACT UP, the Gay Men's Health Crisis in New York City, San Francisco AIDS Foundation, Project Inform, and on across the nation. ACT UP was brave. They stood up loud and proud. There were people living with AIDS in the streets, using their bodies for civil disobedience, getting arrested. They were able to expand access to new drugs, life-saving drugs, by significantly reducing the time needed before they were released to the public. They saved lives. They let people know they were not alone in their struggle during the epidemic. And Larry Kramer was a legendary writer, was a trailblazing activist in the fight for AIDS. We know him from ACT UP and Gay Men's Health Crisis as a fearless leader. He was deemed the most valuable troublemaker by Susan Sontag, so it's a title that I aspire to attain, of course. And Tony Fauci said this of Larry Kramer. So yes, that Tony Fauci. He said, in American medicine, there are two eras, before Larry and after Larry. There's no question in my mind that Larry helped change medicine in this country, end quote. Larry Kramer made a huge contribution to our healthcare system. He even taught us about patient-directed care. I'm personally grateful to him because, as you just heard from my story earlier, I believe that patient-directed care saved my life. And Vito Russo, who was another fearless leader of ACT UP, he said it so well that I'm just going to quote him here. When future generations ask what we did in the war, we have to tell them we were out here fighting. We have to leave a legacy to the generations of the people who will come after us. When the pandemic is over, people will hear the story that once there was a terrible disease and a brave group of people stood up and fought and sometimes died so that others would live and be free, end quote. So you can see, for me, as for many, there's a direct connection between the HIV/AIDS epidemic and medical aid in dying. Think of the goodness the gay community showed, the humanity that we showed the world. We were valiant while the whole world looked away. It's absolutely the proudest achievement that the gay world can ever claim. And no other community, not the cancer community, not heart disease, not dementia community, has ever stood up and fought the way that we did, nor have they accomplished what we did. And as a queer elder, I am so proud to be part of such a righteous community. We should all be proud, but not just in June, but absolutely every single day.
Yeah, you're amazing. And thank you for being able to share just that history and all the phenomenal work that so many of our elders and leaders in community were able to do during that time and continue to do now.
It's what I'm trying to do, is share history.
Yeah, it's absolutely crucial. And it's going to be so impactful as we move forward to be able to reflect on that history and the importance of us continuing this journey of being able to chart and get our care in order. Um, this really started with you just being able to move to awareness. I'm wondering how you went from awareness about medical aid in dying to being able to fully support medical aid in dying.
That is the $64,000 question. So I know there are endless horror stories from the HIV/AIDS epidemic, but to answer this question, Osha, I've chosen to share a story of my friend John, because it's a good example of why medical aid in dying is important. Because there were no medicines, vaccines, or cures for the AIDS virus, immune systems were depleted, leaving people open to horrible diseases that the medical community hadn't seen in years. And John had so many diseases to deal with. I can't adequately explain how he suffered. And I don't really think that you can understand. I think you had to be there to really understand. His suffering was so severe that he couldn't tolerate it anymore. And he wanted to end his suffering. And like I said, there was no legal way to do that. So on top of everything else he and his loved ones were experiencing, he had to do something illegal just to end his suffering. It was a horrible situation. He had his partner, Mike, go out in the street and buy him drugs he planned to use to end his life. And I know that had to be hard for Mike, since he wasn't what we called street smart. Plans had to be made for when this would happen, where it would happen, who to call, and what to do with John's body once John had ended his life. This was to happen while his partner, Mike, was at work to protect Mike from any legal issues. Imagine he couldn't even be with his partner when he ended his life. Remember, this was illegal. So it was important to be cautious and plan every detail safely. The epidemic was difficult and emotional enough on a daily basis. And all this just added to an already unbearable situation. So plans were made and we all said our goodbyes. And the day arrived for John to end his life. Because it was illegal, no one could be with him. So imagine, after all that suffering, then he had to die alone. As planned, I waited to the next day to call Mike to check in and see how he was doing. I asked how everything went, and to my surprise, he said he didn't die. John's attempt to end his life had failed. So now, on top of everything else, he had to deal with a failed attempt of ending his life. And things just kept getting worse. He was even more debilitated now, but he still was alive and he still wanted to end his suffering. So he decided to stop eating and drinking. It took John 10 days to die that way. He died from dehydration. Imagine. It was horrible and unnecessary suffering. And after all that, John was dead. And then a few weeks later, Mike tested positive for AIDS, and the cycle continued. And if you were there, you know that that's how it went. Remember, this is just one of so many stories of unnecessary suffering from the epidemic. And it makes a good point as to how important medical aid in dying is, because people who can't bear their suffering are going to try to end their suffering no matter what. And they should have a safe option. Illegal attempts are violent often, and as with John, they sometimes fail. People deserve to live and die with dignity. And that's why I support medical aid in dying.
Thank you so much for just sharing that story with us and being able to be vulnerable with us. I genuinely appreciate that. And to your point too, just being able to have such a strong reason as to why folks deserve to be able to claim for themselves, I deserve quality of life, I deserve peace, in medical aid and dying. Now I am going to give you a break. You can breathe.
I'm gonna take it.
And I'll talk just a little bit about healthcare proxies and advanced directives and the importance of them. So the first thing is to understand what even these words are that I'm using. So a healthcare proxy is, or a power of attorney, there we go, or healthcare agent. All these words are really to be able to say a person that you choose to make healthcare decisions for you if you're too sick, if you're incapacitated, if you're terminally ill, or otherwise in short term in a state where you cannot make decisions for yourself. So, and I said I would give you a break, but I actually think that you have such a good story too. So I will just ask you quick about what do you think is so important when it comes to choosing a healthcare agent or proxy?
Oh, okay. So I'm glad I'm going to say in advance, this is not a depressing story because I feel like all my stories are very profoundly deep. But so when I filed my first advance directive, my goddaughter was my healthcare agent. I gave it to her and then I never heard from her again. So about 2.5 months later, I called her and said, well, what did you do with the paperwork I gave you? And she said, I put it in the safe. I said, did you read it? And she said, no. So it came to, we both understood that she couldn't be my advance directive. And then I got another friend of mine to do it. And that woman called me 12 times asking me questions. What about this? What about this? What about this? And that is exactly the kind of healthcare agent you want. She wanted to know how I felt so that she could represent me well. And she kept apologizing. And I'm like, don't apologize. It shows that you really want to know and represent me well. For a healthcare agent, you want someone that's going to be assertive because they're going to be coming up against the medical community and they're not used to pushback. And it might be during emergency times and things are moving quickly. So you need an assertive person and you want a principled person, somebody that is going to represent your wishes regardless of what they believe.
That is crucial. And I appreciate you for even bringing up the fact that so often we will do the work of, okay, got the paperwork together, we had maybe one conversation, but now it's somewhere hidden where nobody can get to it. And it's like, okay, what does that do for me? So being able to have a healthcare proxy that absolutely, even if it might appear annoying on one hand to have somebody that's constantly asking you questions, it's so important. It's so important. There we go. Because in the long term, when you are in that crucial situation, you never know when that's going to happen and you're not able to respond and answer any questions in the moment. So you need to get ahead of it. You need to actually have an understanding of that person. And for sure about being assertive, somebody that's really going to advocate for you and not be passive, not have that Midwest nice of like, oh, okay, well, whatever the doctor says, I guess we'll do that. No, what did this person want for themselves? So with this being said, why is it so important for us to have this conversation within the LGBTQ community? One of the first things that comes to mind with this is the reality that, again, we just never know. It's not just a matter of being an elder and having an old age and thinking, okay, well, this is the time to get it together. No, it's a matter of even when you first hit 18, you never know what's going to happen throughout your life. So being able to have the paperwork and have a conversation with someone who can advocate for you is so impressive and important, because let's say something happens tomorrow and nobody has any idea about what your wishes were. Now it's too late. And now we're jumping at the moment to make decisions in panic mode. So being able to have that together early on. And the reality is that there are a couple of defaults if you don't have a healthcare proxy. One of the first ones is that, let's say there's an individual who has been living their full gay life for 30 years. hasn't talked to their family at all throughout that time. They have now a community, they have a partner that they love, they've been living with for years, maybe never married, but then something happens. And now there's no healthcare proxy. Maybe, as I said, they're not married, so it doesn't default to that partner. So who is the hospital going to call? They're going to call that family that might not even know this person anymore. Might not even, if you've transitioned, might not even know what this person looks like anymore. They certainly haven't had that conversation about what their end of life wishes are. But now it's on them to make those decisions, to make the choice about what sort of medical treatment this individual gets. And I don't say that as like, oh, this is a worst case scenario, I just want to scare people into getting their paperwork together. That's not the point. I say this because I've seen this play out time and time again, because I have friends that share the same story, and because this is something that is so real that we need to be aware of it. So not only is that default in place, but also the reality that once that family shows up, they can make decisions around who's around too. Again, like I said, you can't speak for yourself. So maybe they don't want the partner in place. Maybe they don't want those other community members that you've grown to be friends with and have a home with now to be around. And also within hospitals, another default that comes into place is that if they don't know what you want, the assumption is you want it all.
That's
They're
right.
going to keep you alive by all means necessary. So for some people, that might be exactly what you want, right? You might be somebody that is like, any sort of intervention tool, any machine, I want it. For some people, this might feel invasive or frankly unnecessary or cruel to your overall quality of life. So being able to make that decision ahead of time and have a conversation with somebody about whether or not you want all of those different tools to be used for you or not is important. And also recognizing that the reality is we have gone unseen and unheard for so many years within healthcare settings. Alina did an excellent job explaining the history behind medical professionals just leaving us without care. So the reality of, if you want your voice to be heard, you have to push for it. You have to make sure to use this opportunity to take that power back, to actually document and have someone there that's going to speak up for you. So that's another reason why, specifically with the LGBTQ community, it's important for us to have a healthcare proxy, and it's important for us to get our advance directives together. And often I get the question of, okay, but what if I don't have someone? Which there's so many different reasons why this might be the case. And I hear that. I think that for a lot of us that work in this field, it's a really hard question to answer in this moment, but we're actively working to figure out the best answer possible. The best one that I can give in this moment is to be able to look to other community members. It doesn't have to just be family or partners that are speaking for you. This can be someone else outside of that, what we might think is typical, right? Because there are lots of people, to Alina's point too, maybe your close family member isn't actually the right fit because they're not asking the right questions, or they might be not the best person to advocate for you. So looking to other people, or even reaching out to maybe some community services that have folks that are trained, possibly volunteers that do this sort of work. So research in your area, people that would be interested in taking on that role. The other thing though, is if those paths aren't right for you, then just getting your advance directive together, have that be something that is thorough, have that be on a fridge somewhere, talk to your provider about it, even call up hospitals and say, hey, this is my information, just have this on record, something like that. That's not 100%, but it is at least something, and it never really is, but it's at least something that gives some more weight, some more eyes on what you were actually looking for in your healthcare. So that's one way to be able to combat that issue. And the other thing is that I know that for many of us, it's given us peace with LGBTQ couples around the Supreme Court decision with marriage equality. But it's a scary time where we just don't know what the future is going to hold. So this is an opportunity to have a level of security, because at least when you have that information on paper to say, okay, this is the person that's going to speak for me, no matter if you view them as my partner, my life partner in marriage or not, this is still the person that's speaking for me, then that's something that has to be taken. So being able to have that information is important. Now, the other thing is that I've been using this word advanced directives a lot as well. And I want to give some more clarity to what an advanced directive is, and also how a healthcare proxy can help you be able to push this advanced directive and make sure that everybody uses your words. So an advanced directive is really, it's like a general term for the slew of documents that contain instructions pertaining to an individual's wishes related to medical treatment. So if you can't make the decision on your own in that moment, then this is what is going to be used to make that decision for you, if you have one, right? Or it's going to default, as I said, to whomever is around to make that decision in your family or next of kin. So this would be like your living will, which is what I want. Then it's something like your healthcare proxy or power of attorney. So this is who will speak for me. Then it can also include things like do not resuscitate, so not wanting CPR, do not intubate, so not wanting tubes or machines to keep your breath going and lung support alive. Then depending on where you are, some folks might also, physicians might ask you to have something like a portable medical order. This is something that you would work with a physician to be able to create. But that's not necessary every single place. So it's important to have that conversation whether or not this is something that you need. But the other thing that is really important, because I know that this keeps a lot of people from creating an advanced directive, is to know that in most states, a lawyer is not required to fill out an advanced directive. It's still important to research what is true for your state, but in most states, that's the case. So one simply needs to be signed in front of whoever the required witnesses are. And again, this is so important to have, but if you don't have the conversation, if you don't have it out somewhere where other people can access it, then what was the point in putting in all that work, right? So making sure that this is something that people are aware of. So with that being shared, I'm curious too, Alina, can you share with us the importance of making the advanced directives out and available?
So you talk really fast, Ocean. I was making notes like crazy. So
Oh, I'm
I really want to interrupt
so
you, but so ask me the question again, the importance of
yes. And I did see you writing there. I was curious what you're writing. Yes. So the importance of having an advanced directive out and available.
Oh, okay. So I do have another really great story about that. But first I want to tell this story about a trans female who had converted to Muslim from Christianity in the hospital in New York. The biological family intervenes and wins in court. And when this woman dies, they're buried as a Christian, as a male in Christianity. Nothing about their lives were respected by their biological family. So really important to have an advanced directive, really important. That case actually went to litigation. That's one thing. Another thing I wanted to say is that I'm going to tell a story about a friend of mine that had an advanced directive, but nobody knew where it was. You have to make sure that all your agents, your healthcare agents, have your advanced directive. Any hospital in your area that you might wind up in, you bring it to that hospital and have it on file in their medical records there. All the doctors that you're seeing, every single doctor should have one. You need to have ongoing conversations continually. When I do it now, they just roll their eyes at me, but have these ongoing conversations with your healthcare providers as well as your family and your agents, so they know, with or without the directive, they know what you want. Those are all things really important. You want your advance directive to be on the ever popular refrigerator. You need it to be in your glove compartment, because when the EMTs come, they're trained to look on your refrigerator for the advance directive. If you go down in public, they're trained to look in your glove compartment. They're going to look in your wallet. You might have on a bracelet or a necklace. So all these things are really important. It's not enough to have a healthcare advance directive. It has to be distributed. This is what happened to my friend Eddie. He was living in Fort Lauderdale. Their friends hadn't been able to reach him, and so they were concerned, and they went to his apartment and they found him on the floor. He was semi-conscious. They called 911, and on the way to the hospital, Eddie coded in the ambulance. And they resuscitated him. He had an advance directive, but nobody knew where it was. Once at the hospital, he started to pull out all the tubes and needles because that was not what he wanted. So they deemed him uncooperative. Remember, this is in the state of Florida, no judgment. And so they deemed him uncooperative. They sedated him for a couple of days. In the interim, by calling around, his friends found the advance directive was in Palm Springs, California. And remember, Eddie was in Florida. So after 2 days of sedation, they brought him back. And again, he tried to pull everything out. So this time they really sedated him. That finished him. And by the time they brought him back, he was just so weak. It was awful. And I get updates on him that he was sucked on a piece of ice, and you have to be pretty weak for folks to get excited about someone being able to suck on a piece of ice. And the next day, Eddie died. So his end of life wishes were not respected. He would have had a much better chance of that happening if he had an advance directive that was available, if he'd done all those things that I just said. And this is a perfect example of why everybody over 18 years of age should have an advance directive, distribute it, and make sure folks know where it is and what you want, because it's the best chance of you having your end of life wishes respected. Mm-hmm. And I know that it's hard. I'm talking to somebody in this room right now. I know that it's hard to fill out a directive because you feel like you're facing your death. But you're going to be happy that you did it when you are not able to speak for yourself. And that should be what motivates you to do this. And then once you get it done, then you go back to your life and you only use it when you need it. Mm-hmm.
No,
really important.
Absolutely. And that brings up a really good point too, that I know plenty of people that will also keep an extra copy of their advance directive with them when they travel, or even something that's becoming more popular is also at least just having some sort of video recording of yourself talking through this is what my wishes are. So that, again, that's something that you at least have if you are somewhere where they can't easily access to your advance directive. Folks can pull it up. You sent it to everybody. They can, just quick get access to that.
There's also a National Advanced Healthcare registry that you can register with. And so then you can be in the hospital and say, here's a number, or you wear it on a bracelet or a necklace or something. And somebody just chatted that it's a huge gift for your friends and family. And that is absolutely true. Mm-hmm. Absolutely true.
No, this is amazing. And with that being said, I really just wanted to take some time to direct folks to a couple of resources that we have on our website, and then we can open it up. Yes.
Somebody is asking what the national organization is, and I'm going to look in my phone, so don't think I'm being rude, so I can put it in the chat. Okay. Mm-hmm.
And I'm quick responding. So we do have so many different resources on our website to make this process smoother and not as overwhelming, because I know that that's one of the things that can be so hard with this, is that it's like, oh my goodness, but there's so many paperwork, so many questions, all that. So if you go to our website, you can find things like our dementia tool, our advanced care planning tool, end of life decisions guide, things like that, to just walk you through the process and asking some very clear questions that get you thinking about, okay, if I was in this situation, what would I really want? So knowing that that's an option, we also have a free will on there. It's another resource that you can click on and it'll take you to a new tab that folks can get access to. And I just want to reiterate the point that someone made. This is about your health and your well-being, but it's also about the loved ones around you, so that they can have that peace. And in that moment where everything is all over the place and we don't know what's happening, there's at least some reassurance that we at least know what you would have wanted for the most part in that situation. So making sure to get access to a directive and a will, making sure to talk about it with your proxy, and even outside of your proxy with other people in your circle, so that everybody knows what your wishes are, hopefully lessening any sort of debates that would come up. The other thing that I didn't mention earlier was that in your advance directive, you can say, this is the person that I want to speak for me, but you can also say, these are the people that I don't. And I think that that's something that's really important to be aware of as well. And checking in with how your proxy feels. So if they are on board with being a spokesperson for you, or if they're not, then making sure that they're the right fit, or coaching them through being able to advocate for you. Then reviewing this with anybody that's relevant. What were you going to say?
I didn't mean to interrupt. I thought you were done. I'll wait.
No, it's okay.
I don't know if everybody's heard of the 5Ds, but there are 5 occasions why you should revisit your advance directive. I'm on my 4th copy now myself, because if I get a new doctor, then I have to redo it. So the 5Ds are a decade, so every 10 years, decline in your health, diagnosis if you receive a serious diagnosis, divorce, or death. It's someone in your family or friends. So think of the 5Ds, and this is ongoing.
Yes, no, absolutely. And it is important to review it. The other thing that I would add to that is if there's any name changes, to make sure that that's updated in your advance directive as well.
My healthcare agent transitioned, and then I had to go back and redo the whole thing because there was a new name and everything. So there's all kinds of reasons.
Absolutely. Someone just said the 5Ds is really helpful. Can you write those in the chat?
Sure.
Perfect. And the other last thing that I'll end on, and then I'll open it up for some questions, is that there are so many different ways to be able to get involved in this work at CNC if you are interested. We do have the LGBTQ Leadership Council that we're both a part of and do amazing work for, with guiding the organization through being as LGBTQ inclusive as possible, and also connecting with other national organizations and community groups across the country. So if anyone's ever interested in joining on that council, please reach out to me. I will be putting my information in the chat. And then we also do have our end of life consultation team. That's a great place to be able to ask a lot of those specific questions about end of life and planning. And then we also have our state pages that can share more information about action teams like what Alina leads, and storytelling, which is something else that Alina has also done for this organization, to be able to share your story there. We're just checking out our how to get involved page for anything else. Maybe there's just an event that's going on in your area that you want to get involved with. That's also an amazing opportunity to stay connected. So I'll put all this in the chat for the consultation team line, and then also my email and the website link to go to LGBTQ section on the website. So now, is there anything more that you wanted to share, Alina, before we open it up to questions?
I'm good. I think I'm good, but I can't promise, but I think I'm good.
You have time. So as we go in, let me know.
Okay.
But okay, are there any questions that folks wanted to share? And I can also take it off the recording now too, if that makes it feel better, or you can send in things anonymously as well.
I've
We
got,
encourage questions.
I don't really have a question. I just wanted to say this was really an excellent presentation.